Welcome to our discussion on coding for fracture care. Here we have what is known as the Gustilo Classification for open fractures. And this was developed by a Philippine orthopedic surgeon, Dr. Ramon Gustilo, back in 1976 to really indicate how severe a fracture was and really what is the incidence of infection and other complications. So you have Gestio classification starting with 1 that's considered a low energy wound. Yes, it's an open fracture, but the wound is less than 1 centimeter. And as you can see, you can go on down through the severities until finally we end up with 3A, 3B, and 3C. With 3A, there is still adequate soft tissue cover. 3B, inadequate soft tissue cover, and 3C actually is associated with an arterial injury. And here we have the 7 characters that would be associated with each of those Gustilo classifications. And you can look at the chart and see for a 1 classification, your initial care would be the B for that open fracture. You've got the E for routine healing and the H for delayed healing. Would be the same 7 characters for a class 2. For class 3A, 3B, and 3C, again, our diagnosis code is going to capture that severity by using this C for initial care. It's going to show how bad that is. Now, originally, ICD-10 guidelines did not give us a default for this if the physician did not tell us what that Gustilo classification was. But then in 2016, we did have this added to the ICD-10 guidelines that when we do not have it specified, we're going to use the classification for 1 or 2.